morning, everyone. My name is Annette Johns, and I'm the Associate Director of Policy and Practice with the Newfoundland and Labrador College of Social Workers. I will be your moderator for today's education event, Trauma-Informed Practice. And we have over 900 social workers registered for this event this morning, and I want to start off by wishing everyone a happy Social Work Month. Today's webinar is a collaboration between the Newfoundland and Labrador College of Social Workers and the Canadian Association of Social Workers. The presentation will be approximately 75 minutes, followed by a 15-minute questions and answer period that I'll moderate. Please note that all the details you need, like how to access the slide deck and other housekeeping information, is under the housekeeping and announcement widget. All the widgets can be accessed by clicking the blue and white icons at the bottom of your window. You can also resize and move around any of the elements you see on your screen to customize your viewing experience. During the presentation, I do encourage you to type in any questions you may have for our presenters using the question mark icon at any time, and I'll begin asking them at the end of the presentation. Only the presenters and I can see those questions. So I now want to introduce our speakers for this morning, Tammy Manning and Jasmine Barker, who are both registered social workers in Newfoundland and Labrador, and their full bios are available on the webinar platform. But I do want to take just a few minutes to introduce them. Tammy has worked in the social work field for 22 years with experience working with children, adolescents, and adults in the areas of justice, healthcare, and private practice. For the past 18 years, she has worked in mental health and addictions in various clinical and clinical leadership positions, including programs of concurrent disorder services and traumatic stress services. I also want to note that Tammy was the recipient of the NLCSW Pride in the Profession Award in 2021. Jasmine has worked for over 10 years in the field of social work in mental health and addictions and is currently with Traumatic Stress Services. Over the years, Jasmine has been actively involved in the work of the college and is currently one of our communication facilitators. As part of her MSW program, Jasmine completed a thesis titled Exploring Individual Experiences of Time-Sensitive Practices in Rural Newfoundland and Labrador, which was a qualitative study. So on that note, I just want to say that I'm so pleased that Tammy and Jasmine are delivering this webinar for us this morning in celebration of our wonderful profession, and I'll now pass the virtual podium over to them to begin the presentation.
Thank you so much, Annette, for that very, very warm welcome. And I'm Tammy, and my colleague Jasmine is on screen as well. I wanted to say a huge thank you to the CASW and NLCSW for this opportunity this morning. We know trauma-informed practice is certainly something that's very important to us, and we are delighted to have this opportunity. And thank you as well so much to all the participants across the country who have registered and who are attending this morning. We certainly recognize that there's a lot of diversity in the participants this morning in terms of geography, culture, experience level, maybe direct experience working with trauma. And we recognize there's a wealth of knowledge on the screen this morning. So thank you for taking this time with us. And we hope that everyone can take something back to your practice from our presentation today. So before we get into, I guess, trauma-informed practice and the actual presentation for today, I wanted to talk just briefly about who we are and what we do. Annette provided a lovely introduction, and just wanted to talk about the program that we both work in. So Jasmine and I both work in traumatic stress services, and we are a specialized counseling service for adults who've experienced complex symptoms as a result of a traumatic event. We are a program within Eastern Health, and for people out of province, we have 4 health authorities. That is one of our 4 health authorities, and we are located in St. John's, the capital. No diagnosis is necessary for our program. People self-refer, and we use a central intake process. We are primarily a group-based program. Individuals who work with us will normally complete a 30-week therapeutic group, and that has been changed many times throughout the years. We do offer individual counseling as well and a same-day clinic. And we added on a family education workshop a couple of years ago because we recognize that people, supporters of individuals who work with us, can certainly benefit from information as well. So our program is interdisciplinary in nature. We have social work, nursing, psychology, occupational therapy, as well as our clerical and manager. We are certainly a recovery-based program, and we encourage people to connect and avail of all of the fabulous community resources while they attend our program. And we use a lot of different treatment modalities. We work from attachment theory. We work with narrative, motivational interviewing, DBT, CBT, and a number of different therapeutic processes. I also want to highlight we are an example of a trauma-specific service. So trauma-specific service is when individuals seek out and provide consent for treatment that involves assessment and treatment of traumatic impacts. Trauma-specific services can definitely be accessed through community mental health clinics, through community agencies, through private practice clinicians, and different areas. So the rest of the presentation today will focus on trauma-informed care as opposed to trauma-specific practice. And I will pass it over to Jasmine just after I run through the objectives for today. So just briefly, what you can expect to hear about throughout the presentation today, we will define what trauma-informed practice is, and we will look at trauma-informed practice from an individual perspective, a practice perspective, and also to look at it through an organizational perspective, which is really important. We will talk about ways to increase safety, choice, and identifying strengths. And we know that social workers certainly work from a strengths-based perspective, and we will talk about many ways that you can enhance that hopefully today. We will talk about understanding and assessing trauma. So defining what trauma is and looking at different things to keep in mind in terms of the assessment process. We will talk about the different phases of trauma, recognizing that not everybody who is attending will work with all the phases of trauma, but certainly beneficial to be aware of all. And we will highlight some considerations for care, and considerations for care will include helpful tips, really, that you can take back to your own practice. And we will also talk about trauma-informed workplaces and self-care, because we know that as organizations, being trauma informed is so important. And we also know that self-care for social workers is also so vital. And we hope that today you certainly get validation for the good work that you are already doing. Many times when we do these presentations, we hear from people that they are doing a lot of this trauma-informed work. So we hope today will be very validating. And I will pass it over to Jasmine to start us off with trauma-informed practice.
Thank you, Tammy, and thank you to Annette, and happy Social Work Month to everyone here today. So we're going to begin by talking about trauma-informed social work practice. And it's important to recognize that the core of social work practice from a trauma-informed lens involves a shift in thinking, as social workers seek to understand a client and their symptoms in the context of their life experiences, their culture, and their society. It attempts to be able to see the whole person and not just the problems in which they are presenting. A core belief of trauma-informed social work practice is that individuals can recover, and it uses focus on strength and resiliency to be able to identify the strengths and resiliency that each individual possesses. Trauma-informed social work practice recognizes the prevalence of early adversity and traumatic experiences, and it and it recognizes how these experiences can impact an individual's coping and fundamental beliefs about themselves, others, and the world. As Tammy mentioned, trauma-informed social work practice may not seek to treat trauma specifically, but to be able to integrate knowledge and understanding of trauma experiences into all levels of social work practice and services, as well as in the development and implementation of all policies and procedures. So why be trauma informed? Trauma can affect anyone and at any time. Within Canada, we know that 73% of adults report some form of traumatic exposure during a lifetime. 9.2% of these individuals meet the criteria for post-traumatic stress disorder. 50% of Canadians have experienced one incident of sexual or physical violence throughout the lifespan as well. So given the prevalence of traumatic experience, it is vital as social workers that we be trauma informed. No matter what level of service you are providing, having this recognition and understanding is imperative to promoting effective social work practice. Awareness of trauma symptoms, responses, pathways, resources can influence receptivity and engagement. Social workers who are trauma informed are better able to deliver service in a manner that conveys respect, compassion, promotes self-determination, and helps to reduce any risk of re-traumatization. Social workers that are trauma-informed are also sensitive to and attentive to the impacts of cultural and global issues and how these experiences can impact individuals. And we're going to discuss this a little later on in our presentation as well.
All right, so there's much literature out there about trauma-informed practice principles, and I really like how these are grouped here into the 4 R's. It's a very easy way to remember them. The first one stands for organizational-wide realization of how trauma affects people and understanding the potential pathways for healing. So that is really understanding, like Jasmine just talked about, some of the prevalence and the ways people are impacted. And we'll get into that later, the biological, psychological, and different impacts. And then some of the treatment pathways. Ability to recognize signs and symptoms of trauma. And that is so important in your work with individuals, whether it's a one-time encounter or someone you work with long-term. Recognizing a trauma response and how to respond to it is so important. System-wide response to trauma that informs behavior, language, programs, and policies. And we are all responsible for trauma-informed practice. And we are all responsible for contributing to trauma-informed practice within our teams and organizations. So figuring out what is helpful and what is not helpful. And part of that is certainly educating yourself around trauma-informed practice and educating others. Resisting re-traumatization of individuals. And we know that re-traumatization certainly does not happen deliberately. However, re-traumatization can happen when individuals don't fully understand what trauma is, when individuals don't fully understand what a trauma response looks like, and the importance of offering choice in all interventions. And these 4 practice principles will be expanded on throughout different topics in the next hour or so as we present.
Okay, so as social workers, preparing for a trauma-informed practice at a personal level involves ongoing education and critical self-reflection. And these processes can feel uncomfortable at times as you explore your own understanding of trauma, as well as your own personal beliefs, assumptions, and experiences. Being trauma-informed does not require that someone has to be an expert around trauma. It's being able to educate yourself formally and or informally to be able to have an increased understanding and awareness of trauma symptoms, responses. As social workers, many of us have experienced varying degrees of trauma ourselves, and many more have been exposed to repeated stories of trauma and abuse. And given this, it is so important as social workers to critically reflect on how these experiences can impact our individual practice. Being able to look at our own individual experiences, our stories, diversity, our culture, and explore the potential impacts that this can have on ourselves as professionals as well as on our individual practice will allow us to be able to provide a more effective service. Being able to ask yourself some reflective questions such as what underlying assumptions or beliefs do I have around trauma and recovery? How have my own individual experiences impacted what I bring to my practice? What responses or behaviors might be triggering to me? How do I know and respond to these situations? How do my cultural background and personal experiences of diversity influence my interactions with others?
Okay, so continuing on with that discussion about preparing for trauma-informed practice at a practice level, just that critical awareness of yourself as a practitioner and critical awareness of language that you use is so important. As social workers, we practice from a strengths-based perspective. We practice often as part of interdisciplinary teams and within different models, like the medical model. And we know that when individuals come to work with us who have a significant history of trauma, many times they come to us and their trust has been violated by caregivers, by individuals in their past. Sometimes it might be difficult for individuals to answer questions. Sometimes individuals might not be comfortable sharing information. And there are many reasons for that because of the ways their trust has been impacted. So it is really imperative for us as social workers to approach that from a really trauma-informed lens and recognizing that that is a normal human protective mechanism when an individual feels vulnerable. So it is our role to be open and to be inviting and to be compassionate and to engage in respectful ways of encouraging receptivity. So just having a critical kind of lens to the language that you use, being aware of a question like what is wrong and reframing that to what has happened. It is such more of a curious way of asking a question, and it shows openness and curiosity about the individual. Sometimes shifting the word symptoms to adaptations. Many times we hear from people that we work with, I have all these symptoms, so will I ever get better? And when we are able to reframe it and really educate the person around adaptations, that really it is tools and solutions that they have used that have helped them to survive. And sometimes they don't work as well over time. Being aware of language like complex, resistant, guarded, and recognizing that many times there are reasons that individuals find it hard to answer a question, and recognizing they are trying to connect in the best way that they can. And many and all are so resilient and so strong, and they have been through so many experiences. So having that critical lens can certainly improve. We're going to move into now talking about understanding trauma. So understanding trauma results from an event or that is experienced by an individual as physically or emotionally harmful or life-threatening and has lasting effects on the individual's social, mental, physical, and emotional well-being. So I'm going to break that down a little further. And the event or events that can result in some of those effects are multitude. Trauma can result certainly from a single event. And a single event, an example could be something like an accident, natural disaster, a sudden loss. Then complex trauma can often result from like ongoing abuse, domestic violence, or situations where an individual feels physically and or emotionally trapped. Developmental trauma is the kind of trauma that we work with quite frequently, and it is the kind of trauma that results from experiences very early on in life. Events that happen often in infancy or early childhood, and examples are neglect, abuse, emotional abuse, not having needs met, and usually or often occurs within the caregiving system. Intergenerational trauma. Intergenerational trauma focuses on the psychological or emotional effects that are passed on really when an individual is cared for by someone else who has experienced trauma. And adaptations then and coping skills are passed from one generation to another. Historical trauma. Historical trauma is so significant, and it involves psychological wounding across the lifespan, really, and across generations from massive group trauma. And there are many examples: war, slavery, genocide, residential schools. And we certainly know that our First Nations population has been so impacted by historical trauma in many ways. Um, I should highlight as well that learning about a traumatic event that has impacted someone close to you can certainly lead as well to lasting effects. And hearing about details of traumatic events can certainly lead to lasting effects. And that is important to really understand as a social worker or as a counselor who provides support to people. So those are some of the examples of the trauma event themselves, and want to talk a little bit then about how trauma develops in an individual. We get the question all the time, why would two siblings who live in the same home, have very similar circumstances, experience very similar traumas, and have very different outcomes? Or why two friends who experience a very similar traumatic event at age 30 have two completely different outcomes? And really understanding there are a whole bunch of variables that impact how an individual is impacted and the long-term effects. So some of the individual variables, age is something that is so significant. Trauma can impact someone significantly at any age. However, we know that when a trauma happens or when traumas happen at a young age, it certainly impacts people usually significantly. Coping skills have not been developed at that time. An individual hasn't fully matured. We also know that when an individual experiences early life trauma, they are likely to experience a trauma later in life more significantly than someone who has not experienced a childhood trauma. There are many other factors. So if an individual has depression symptoms or anxiety at a very young age, often they are impacted differently by trauma than somebody else. Any of the circumstances really that we are born into or impact us very early on in life. So that can include things like a history of early losses, and that could be losing grandparents or caregivers who might be significant supports. It could be moving multiple times throughout childhood and not having that sense of stability. Not having adequate supports and people that an individual can count on for safety in childhood is significant. Things like growing up in circumstances where there's significant poverty or significant substance use in the home or mental health issues. Things like if an individual experiences dissociation during specifically a childhood trauma, It can impact how they are impacted over time and any unmet needs as well in childhood. Many individuals might be familiar with the ACE study that was completed years ago. And the ACE study talks about adverse childhood experiences. And we know that, the more adverse childhood experiences an individual has, it certainly impacts how they are impacted by traumatic events. So things like our social supports and our biology as well. Then there are some of the stressor variables, and that includes things like intentional acts of violence. We know, again, every trauma can be significant. However, when a trauma is deliberately caused by another human being, it is so significant, and it impacts things like attachment, it impacts trust. When a trauma is caused by a caregiver, it certainly impacts an individual's trust moving forward as well, and can often lead to like a disorganized attachment patterns, which can be carried into adulthood and affect things like boundaries and affect trust in adult relationships. Things like the longer the duration of the trauma, the frequency of the trauma, unpredictability, and presence of life threat. All of those factors are so significant because when a trauma goes on for a significant period of time, or when there's multiple traumas, an individual's stress response is always turned on because they never know when the next bad thing is going to happen. Same when there's unpredictability. An individual walks on eggshells, not knowing when the next traumatic event is going to happen. And the presence of life threat, just waiting for something bad to happen and feeling scared all of the time. The other thing to consider in terms of variables are social variables. So social variables include things like validation or lack of validation, and that could be through societal messages. Things like, you should be over that by now, or it wasn't that bad. If an individual is able to do some counseling or do some work following traumatic events, and to develop some, radical acceptance that it has happened, it can certainly impact the individual's outcome. Things like other protective factors, and that is things like social supports, are so significant. If an individual has caring, compassionate individuals in their lives who validate and who understand, it can certainly help an individual move forward and to work on the trauma differently and learn to count on self and build self-esteem. So all of those factors are so important when we think about how a trauma develops in one individual as opposed to another.
Okay, so from understanding how trauma develops, it's also important to look at how trauma can present. And we know from our experience from working with individuals who have experienced trauma that trauma rarely presents as just trauma. It is therefore so important to be able to recognize the varying ways in which trauma can present in order to have more insight into how this can influence someone's pathway or course of treatment and also diagnosis. It's also important to note that presentations are individualized and can vary from substance use or addictions issues to self-harm, suicidal ideation or attempts, personality disorder, grief, loss, symptoms of mental illness. All of these presentations can highlight the likelihood of trauma, and being able to be aware of that can certainly help in terms of supporting the individual and providing the most effective and efficient care. So, moving into trauma symptoms. After an individual experiences a traumatic event, they can experience varying degrees of symptoms. And for some individuals, these symptoms can disappear naturally over time. And for many others, these symptoms can persist or even intensify long after the traumatic event has occurred. And it's also not uncommon that people can just experience symptoms out of nowhere, and not be able to kind of associate it to a particular traumatic experience. And although trauma symptoms are normal reactions and adaptations to abnormal and traumatic events, they are incredibly distressing for the individual and can impact their overall quality of life. It's very common for the individuals that we work with, when they come in to meet with us, to say, there's something wrong with me for thinking or acting this way. And being able to normalize the symptoms of trauma can really help to shift them into being able to understand themselves more and to be able to be more compassionate to themselves. The following responses to trauma and traumatic events that I'm going to discuss here now are also components of the post-traumatic stress disorder diagnosis. And as Tammy previously mentioned, a formal diagnosis of PTSD is not required for a trauma-specific service. It's important in being trauma-informed that we recognize these symptoms and how they can be related to a person's experience of trauma. So the first component of symptoms that I'm going to discuss is hyperarousal. So individuals who experience hyperarousal symptoms often feel like they're continuously on edge. They have heightened startle reactions. They often say, like, I feel like my reaction at any moment is really disproportionate to what's happening. So like if a book falls on the floor, and they describe, like, I feel like I'm just jumping out of my skin. They can experience a lot of difficulty concentrating or disruptions in sleep, and impairments as well in mood. People that struggle with hyperarousal say, I feel just continuously on edge. I'm always scanning and looking around, and that causes me to feel really irritable. Re-experiencing symptoms refer to the intrusive symptoms that a person can experience. And that is in relation to intrusive thoughts, memories, flashbacks, nightmares. And when a person experiences intrusive thoughts, memories, or flashbacks, it can make them feel like they're right back in that particular moment when the trauma was happening. Avoidance and withdrawal symptoms are very adaptive for people, and it's important to be able to highlight that any symptom that has allowed, or any adaptation that has allowed a person to survive up to now, has played an important role. And avoidance of people, places, or things related to the traumatic event has allowed that person to be able to survive. At the same time, it can also result in a lot of isolation or disconnection. Sometimes people rely on substances or suppressing thoughts, or being actively or overly engaged in activities in an attempt to avoid or withdraw from their traumatic experiences. The last component of symptoms relate to thoughts and feelings. Very normal for people who have experienced trauma to experience excessive blame towards themselves, others, or the world. Not uncommon that people will say, like, I have so much difficulty feeling any emotion, let alone, emotions such as joy or happiness. Sometimes people say they're on a continuum emotion where they're feeling, neutral 1 minute and then overwhelmed with sadness or anger. Not uncommon as well that people can experience just a lot of negative thoughts in general about themselves, who they are as individuals, and about others and the world.
Right. So I'm going to talk just a little bit about, Jasmine has provided an overview of some of the symptoms, and I just want to talk about what the impacts of those symptoms are on a person long term. So every human, we all have an activation of the survival response, and that is the fight, flight, freeze, and submit or fawn response. And that is a normal protective human mechanism, part of evolution that we all have. to protect us from danger or perceived danger. And for most of us, when our fight, flight, freeze response is activated, very quickly we go back to a restorative state when we recognize that danger has passed or danger is not present. For individuals who have experienced trauma, this fight, flight, freeze response is activated more often than someone who has not experienced trauma. And as well, it takes longer to go back to a restorative state. So the result is, over time, one of the impacts is physical health issues, because our bodies are not meant to be in this fight, flight, freeze response much of the time. And for people who've experienced trauma, when their body is in that mode a lot of the time, not uncommon that they have many, many health issues associated. So just want to talk briefly about the survival response and what actually happens. When our fight, flight, freeze response is activated, the back part of our brain, which is the brain stem, it's the first part of our brain that evolved during evolution. That part of our brain kicks in, and our body, the blood flows to our legs. We get ready to respond to danger or perceived danger. The blood flows to our legs, our heart starts to beat faster, our breathing gets quicker, our digestive system shuts down. Sometimes our fingers feel tingly. We can feel lightheaded even. And then the middle part of our brain is responsible in part for memory and emotion. So the part of our brain called the amygdala, which is responsible for emotion, that part of our brain sounds an alarm in response to the danger or perceived danger. When the amygdala is activated very often, what happens is also another part of our brain in the center called the hippocampus. The hippocampus is responsible for setting down new memories. That part of our brain becomes underactivated, and it becomes difficult to set down new memories. At the same time, when the survival response is activated, the frontal part of our brain, the frontal cortex, which is responsible for logic and reason, that part of our brain is really hard to access. So accessing things like, what should I do in this situation? What is the best course of action? Becomes really challenged. So when this is activated much of the time, it makes sense how memory becomes impacted over time. Executive functioning becomes impacted. Individuals talk about, I feel unsafe. So when that middle part of the brain is activated quite a bit, individuals' ability to regulate emotions sometimes can get impacted over time. And they can feel unsafe even with themselves in terms of their own decision making. They can certainly feel unsafe with others because they perceive danger, and it's difficult to have trust. And they perceive danger in the world. So their relationship with the world changes as well. So over time, all of that has impact on attachment patterns, and certainly has impact on relationships and things like sleep and trust and trying new things. And brain changes happen over time. And we certainly know that there are many restorative things that can happen through a good work to restore the brain back. And for any of you who are working with individuals, anytime you activate the relaxation response, whether that be through helping someone deep breathe, helping someone relax, helping someone engage in mindfulness, you are actively doing some good work in terms of the fight, flight, freeze response.
All right, thank you, Tammy. So recognition of possible signs of a trauma response is such a critical piece in providing trauma-informed care. And there are a variety of reactions that can be observed in an individual experiencing a trauma response. And these can range from physical, mental, emotional, or behavioral reactions. And these reactions can be in response to a specific trigger, so something that a person can relate to their traumatic events. So if they see a red truck going down the road and they notice that they're really reactive because it reminds them of their individual trauma. It can also be in response to an internal trigger, such as a specific emotion like fear or anger. And this can provoke a trauma response. or sometimes it can be in a response to an unidentified trigger. And that is when a person is experiencing a trauma response and are unable to recall specific details that are triggering that response. And we know that individuals, when they experience a trauma response from an unidentified trigger, it can be incredibly distressing because they want to be able to kind of make sense of their experiences. And it's important to note that trauma memories are stored in the body. And as Tammy mentioned earlier in talking about the different types of trauma, some traumatic experiences happen so early that a person may not be able to recall the specific details, but certainly are impacted by those experiences and will respond to them when triggered. Being able to recognize trauma responses is so helpful in being able to promote safety with the individuals with whom you're working, and just normalizing that these are a normal response is so important, because oftentimes when an individual is experiencing a trauma response, they feel a lot of shame around how they're responding. I know in the work that we do, people will continuously apologize for how they're reacting or how they're responding. So having that awareness can certainly help to kind of normalize that reaction and help to promote safety in any working relationships. So some possible signs of a trauma response can be observed in changes in breathing. We know, as Tammy just explained, that when someone is activated, they can take in more oxygen than they need, or on the other hand, they may hold their breath. You may notice that someone starts to sweat just excessively, or they can experience a strong flooding of emotions. You can be having a conversation and all of a sudden they're really overwhelmed, maybe by sadness or anger or fear. They can be really hyper aware, so just disconnected from the conversation because they're scanning or flinching or maybe shaking in a particular moment. Staring off into the distance or being unable to speak or recall what it is that you're talking about can all be possible signs of a trauma response.
Okay, so we are going to move into talking about how to actually ask about trauma and assess trauma and some of the different ways that we can provide treatment. But before we do that, Jasmine is going to talk about some helpful tips. And these are applicable no matter what your interaction with an individual from a trauma-informed perspective. It could be a one-time encounter or an ongoing relationship with a client.
Okay. And one of the things that I find in talking about some of these helpful tools and techniques is that from collaborating with other professionals, there's so much of this work being done that sometimes professionals don't even know that they're doing. And a lot of this comes from ability to be able to pay attention just to the individual's responses and their words and offering support in a non-judgmental way. Being able to offer reminders of safety and ground the individual back to the present moment. And as social workers, these are things that I find we naturally do just in our own role modeling. So if you notice that someone is experiencing a response, even modeling deep breathing, just taking a second, slowing things down, telling the client that, you're safe, reminding them of the date. Because we certainly know that when they're experiencing a trauma response, they can feel like they're right back in that moment when the trauma was occurring. So being able to orient them to the time can certainly help ground them in that particular moment. We know that a trauma trigger can be anything in relation to the senses. Anything at all can trigger a trauma response. And at the same time, we also know that there are so many things that a person can use that can help to trigger a relaxation response. So being able to explore with an individual what kind of things help you to feel connected, what kind of things help you to slow down your breathing, connect you to your surroundings. One of the tools that we will often use in our service is the 5-4-3-2-1 tool. And this tool really encourages the individual to engage their senses. So we ask them to name 5 things that they see, 4 things that they can touch, 3 things that they can hear, 2 things that they can smell, and we get them to say one nice thing about themselves. And by using this tool, it can really help them to increase their confidence in responding to symptoms. We certainly know as well that things such as cold can really help to ground a person in a particular moment. So we will often have like ice packs available in our office, but sometimes even just encouraging someone to have a cold drink of water can be really helpful in slowing down their breathing and helping them to connect their awareness to the present. As social workers, it's just so important that we always be aware of our own body language and our potential to even be triggering to clients unintentionally. So ensuring that we're using a calm voice, that we're aware of our body language. You know, maybe if you're someone like me who likes to talk with a lot of hand movements, just being aware of how someone might respond to that. Being aware of allowing space and ensuring no sudden movements in any interactions can certainly help in promoting an individual's sense of safety and allowing them to feel accepted and that you're providing a space for healing that is non-judgmental and incredibly supportive.
Okay, so I am going to talk about asking about trauma and then the assessment of trauma. So when we are thinking about asking about trauma, it is so imperative first to assess safety. Safety, safety, safety. Safety, stability, and the ability to engage. So asking yourself things like, is the client having unsafe or suicidal thoughts? Have they experienced a recent trauma? Are they in a place that they can actually ask these questions? Asking about trauma may or may not be part of a conversation. So really reflecting on your role, where you are, and do you need to ask about the details of trauma? If it is necessary and if it's part of your role, absolutely do so. If it's not, it might not be information that you need to gather, or possibly somebody else has gathered it. Noticing those signs of a trauma response, as Jasmine outlined, and being able to respond to that in the appropriate ways. Offering choice where possible. And we know that for many individuals who have experienced trauma, boundaries have been violated and their personal rights have been impacted in so many ways. And many are not even aware of some of their own personal rights. So being really upfront with someone and letting them know, it's okay to take a break if you want to. Or if there's a question you're not comfortable answering, feel comfortable not to answer. That is so important, and to communicate that verbally to someone out loud. Being able to be attentive to the physical environment and privacy. We know that privacy can certainly be challenging in areas if you work in a hospital or a community setting or some other setting, but finding a private space as much as possible. And attention to physical environment when we consider things like hypervigilance that Jasmine talked about. For an individual who experiences trauma, it might be really important to sit in a place where they can actually see the door or are close to the door. For many individuals that we work with, they talk about the importance of having their back to the wall. Asking permission if you need to touch the individual for any reason during the assessment, if that's part of what you need to do, asking permission, and being really aware of physical space. For many of us, we have a personal space of 2 to 3 feet. When individuals have been impacted by trauma, for some people, their personal space might be much larger, like 6 to 8 feet. So being aware of that, and even things like not walking behind the person, if you leave a waiting room, walking beside them if you can, and sharing what to expect ahead of time and following through with any promises. If you promise to make a phone call, making sure you do it. Letting the individual know we're going to talk about these questions and then we're going to move to another room. As much as possible, sharing ahead of time what to expect is important. Okay, so, and then if you move into the assessment and actually asking about the trauma itself, being aware that for some individuals, they might be really reluctant or hesitant to disclose, and for others, they might need assistance with containment. So for individuals who might be hesitant to provide detail, there are many reasons for that. An individual's trust has been violated. For some people who have experienced trauma, this is a secret they have carried forever, and they might never have shared it out loud. For some individuals, they are fearful of the details and how it might impact others. So they might be protecting you as a clinician. For some individuals, they've carried intense guilt and shame about trauma, and sharing details out loud can be very difficult. Other individuals, might feel that I need to come in and I just need to share all the details and I'll feel better. And for many, they haven't had good modeling around boundaries and haven't really been taught boundaries. So as a clinician, it is really important for you to develop a relationship first and to develop safety first. So slowing the individual down and letting them know we will get to that and we will talk about some of that. But first, we need to build on some safety and some skills before we get to that place. As a clinician, if asking about trauma is part of your role, feel comfortable to ask, because an individual will know if you are holding back and you are not comfortable asking questions. Expect any sort of reactions. Again, because an individual's trust has been violated, they might be quiet, they might be hesitant. Sometimes someone can appear irritated or angry. And coming from a trauma-informed lens is about compassionately understanding the reasons that people are going to react in different ways and being prepared for different responses. Always being empathetic and compassionate in your questions, and being very clear and concise is so important. So an individual might not understand a question like, have you ever been abused? Because that might mean different things to different people. So being really specific and asking a question like, did someone ever do something sexual or ask you to do something sexual that you weren't comfortable with? Much more descriptive and much more clear. So again, following these in the assessment as much as possible.
Okay, so we're going to move into the different phases of trauma treatment. And it's important as social workers that we be able to recognize our role within the phases and also pathways or resources for services for individuals that may require a specific phase. We certainly know for individuals that journey through these phases of treatment are not always linear, and they can be impacted by so many different things such as acute stressors, new traumas, or worldly events such as the impacts of the past 2 years in the global pandemic. We also know that people will start and finish in different places, and having that conversation and awareness is so important in being able to highlight an individual's needs, being able to make a clear clinical assessment and support access to the most appropriate service to meet the individual's needs.
Okay, so I'm going to talk about, we just need to go back one, I think. I'm going to talk about the education phase, which is the first one. And education really is about understanding the development of trauma, how it develops, some of those factors that we talked about earlier, some of the individual variables and stressor variables, and talking about the impacts for the individual long term. Part of that is helping the individual understand those biological responses, the fight, flight, freeze response that I talked about earlier, helping individuals understand some of the psychological impacts of trauma. So, understanding that how their thinking gets impacted by some of the events that have happened to them. Relational impacts, so understanding how trust and boundaries, communication styles, how an individual might take on a caretaking role because of the trauma they've experienced, and some of the spiritual impacts when individuals find difficulty in finding meaning in the world. A big part of what we notice happens during this education phase is that increase in self compassion and the increase in understanding. An individual starts to move from a place of, why do I keep doing this? Why do I freeze? Why do I run away? And they start to use terms and more compassionately. So we will hear people say things like, I was triggered. That is a normal response in this situation. What is it that I need to keep myself safe and keep myself in the present? For any of you who are doing work with individuals, and maybe you're working teaching some mindfulness skills or acceptance and commitment theory, dialectical behavior theory, or you are helping individuals be connected to community resources, all of those are so important here in the education phase, in learning to regulate emotions and learning to really recognize what triggers are and what some of that fight, flight, freeze response are, and some of the skills that they might start to reach for.
Okay, so the next phase is safety and stabilization. And in this phase, it's so important to be able to outline expectations, to explore individual boundaries and maintaining boundaries in any professional relationship while also clarifying role. We know for many individuals who have experienced trauma, they've had their safety violated. And for some people, their own understanding of safety becomes really difficult to even be able to understand for them at an individual level. So being able to explore with them their own personal meaning of safety, thinking about what they need to be able to create safety with themselves, with their thoughts, with their emotions, in relationships, and then with the world. Being able to highlight that safety is not black or white and that it's a continuum, and what a person may need, from one day to the next or from one relationship to the next to promote safety can often differ, and being able to offer choice around that. In order to be able to promote safety and stabilization, the individual must recognize their own individual choice, as well as recognize their own resources, strengths, and ability in being able to respond to and promote their safety. So by identifying and learning triggers, that can be really helpful for the person in being able to understand what it is that they're reacting to, and then to create a plan around what they need in response to that. Teaching of skills is often done at this stage, where a person, again, who is already coming into any working relationship with their own toolbox of skills, learns how to kind of fine tune what is really working for them. They can add in new skills such as maybe like mindfulness or grounding, emotional regulation, distress tolerance, and see what works for them. Being able to have that safety to explore and try new things is so important in being able to promote stabilization. During this stage, there's often an increased focus on self. We certainly know that people who experience trauma spend the majority of their life responding to symptoms. They learn how to put their own needs on the back burner. So being aware of their thoughts, their emotions, their responses, being aware of their personal rights, being able to label their specific feeling that they're having and understanding maybe the message that is underlying that and knowing that it's valid. All of those messages and understandings help to be able to promote choice. And that also helps to be able to move the individual towards being able to sit with setting boundaries and some of that discomfort that comes from creating that change.
Okay, so the next phase is the processing of traumatic experiences. And processing of traumatic experiences might be something that you do in your work, or partially, or maybe not at all. So processing is about acknowledging the experience and normalizing the symptoms and the impact. And with processing, it is really important to understand that it is not about talking about every traumatic event in detail. It is more figuring out for the individual, while providing them choice and safety, what is it for them that is having lasting impacts? What have they felt that's not resolved? Maybe what event or trauma events have they carried guilt and shame around? What event might they need to further explore in terms of some of the losses? What trauma experiences are currently impacting relationships? And what is it that they need to carry less of? What is it that they need to let go of? Sometimes it is not the biggest trauma, but it might be the event that has just rumbled around in their mind for some reason. And one of the goals is to decrease the intensity of the emotions that the individual experiences as they start to share and normalize the trauma experience. For individuals who completes this stage in a group process, they might choose to share some of the information in the group and maybe some individually. One of the biggest goals, I guess, around processing as well is the validation, because the sharing is important and the impacts are certainly significant. But also for the individual really hearing, this was not your fault. You did not cause this. You did not deserve for this to happen to you. What is it that that inner child needs now to heal? What does that individual need to start to heal and move forward? And developing a new understanding of the trauma experience is what creates room for new things. The trauma, when it's externalized, it starts to make room, and the individual starts to recognize that the trauma is no longer the dominant story. It is something significant that impacted them, but it is not who they are, and it makes room for some of the things in the reconnection stage that Jasmine is going to share.
Okay. So at the reconnection stage, this involves reconnecting with yourself, others, and the community. And for many individuals, this can be really uncomfortable as they go out and try out new things, and oftentimes sit with some of this discomfort that comes from creating change. For many individuals, they'll say, like, I don't even, for such a long time, I don't even know what I was interested in or who I am or what I enjoy. And at this time, a person will go out and start to explore some of the things that are of interest to them. And doing so, they start to be able to explore the who and what is important to me. Being able to kind of highlight their own individual values and the behaviors that helps to support them in moving towards those values. Reconnection can also bring with it an exploration and processing of the grief and losses that come from traumatic experiences. As a person moves towards reconnection with themselves in the present moment, they will oscillate back and forth between the losses of their trauma experiences and processing of the emotions around that to connecting again with their present, in the present moment, with the things that are of importance to them, to the things that they're valuing, that they're recreating as they're learning the world and discovering new things. Reconnection also can highlight the importance of acceptance. A person who explores acceptance acknowledges what is. It does not mean that they agree with what has happened, but they acknowledge what has happened up to now. And for them, that can provide opportunity for resolution. And this is something that is very individualized, and it often explores forgiveness around any perceived role that they may have thought they had in their traumatic experiences. So being able to process their thoughts and feelings around that, being able to offer themselves forgiveness for any perceived involvement can really help to fuel them towards increased post-traumatic growth. During the reconnection stage, there's also a lot of reflection around an individual's personal strength, around what they have accomplished and overcome. During this stage too, people are often able to kind of even verbalize for themselves, like, wow, like, look at what I have achieved, or look at what I have been able to do. And in that, they start to demonstrate a more appreciation for life and new possibilities. And this is where we often see that spiritual change as people start to kind of become more aware of what's important to them, and their trauma experiences are no longer that dominant story. It's more around who they are as individuals. For some social workers, your work may be beginning in this stage as people come and start to maybe reconnect with the community, or want to be able to rebuild relationships or explore new interests. So being trauma informed at this stage is so important to recognize how vulnerable it can be for a person as they start to move towards reconnection. How much discomfort that can come with creating change and growing. It's also really important to be aware of the potential obstacles that can impede reconnection. We certainly know over the last 2 years specifically that reconnection has been really challenging for many individuals that have been wanting to build up like social connections because of the global pandemic and the isolation. Living in Newfoundland, we know that geography is certainly can create challenges. People maybe want to connect when living in more rural areas. So being aware of and attentive to these obstacles are certainly really important at this phase of treatment.
Okay, so we are going to shift gears pretty dramatically for the next few slides. And these next few slides really could be 2 to 3 presentations in and of themselves. We are going to talk about trauma-informed workplaces and organizations, and self-care for you as social workers, and we're going to touch on the global pandemic as well, which is so important. And each of us as social workers, we have a personal responsibility to contribute to trauma-informed practice at our own practice level, with our clients, with our teams, and in our organizations. And we will highlight many of the ways that you can do that by becoming further educated yourself, by sharing resources with your team, by seeking out resources, by having input into policies and procedures when you can. And, always focusing on your own practice and just having that good critical lens to your own practice and your own wellness as well, and seeking out support when you need to. And Jasper is going to talk about trauma-informed organizations and teams.
Okay. This part of the presentation I find is really energizing, especially as social workers, because I certainly believe in our ability to be such effective agents of change. And there's so many possibilities within organizations to be able to be more trauma informed. So thinking about, the organization in which you work, if there's opportunities to develop competencies specific to trauma informed practice, I know working within Eastern Health, we've often provided feedback around policies and just related to care, and been able to create some changes, even specific to forms that govern our organization. Being able to have discussions with supervisors and leaders around the importance of education and ethical considerations for trauma-informed care, exploring opportunities or requesting opportunities for education and training. I know within supervision, sometimes there's often an increased focus around trauma-informed supervision, and as for any supervisors or people in positions of leadership, having that openness and ability for feedback around trauma-informed services and being able to promote that within your organizations. And also, as organizations in which we work as social workers, it is absolutely imperative for policies and procedures to be in place that help to support employee wellness. As social workers, providing trauma-informed care and providing services, being able to critically reflect on what you need as an individual and having opportunities within your organization that can help to support your wellness will greatly contribute to the work that you're able to provide, and thus will help in being able to ensure, the recruitment, retention, and, potential training around trauma-informed care of staff. So if the staff if they're able to promote their wellness, then they're going to be in a place to be able to support others in theirs. Moving into a discussion around trauma-informed teams, thinking about moving towards a trauma-informed teams can begin by just a conversation. How language can influence change is so important. Being able just to even go back to your team after even attending this presentation and talk about maybe something that you have taken away, or maybe something that you want to be able to learn more about. Exploring opportunities for sharing of information and knowledge. If there are people within your team that may have done some specific training, whether that's formally or informally, and how can you share that? How can you build upon that? Maybe there's opportunities to be able to do some capacity building and consultation. Within our program, we have a recurrent collaborative practice in which other members of our community mental health team will meet with our team regularly to consult around trauma-informed and trauma-specific practices. We also provide presentations and really encourage consultation and communication with all individuals and professionals within our community. We have been involved in training of police cadets and educating other community service providers around trauma-informed care. So the opportunities for capacity building and being able to increase the sharing of information there's so many opportunities. So being able to explore what your options are. I know at an individual level, when I first started out in my career many years ago, I didn't have a lot of formal education around trauma-specific service, and at that time was able to avail of trauma-specific training. And from that, I was able to bring it back to my team and share with them, and being able to build on the services that we were providing. So being able to increase our own knowledge knowledge, whether that again is formally or informally, helps to build knowledge within the teams as well. And I think that as social workers, being able to elicit feedback from the individuals with whom we provide service can certainly help to promote more trauma-informed teams and thus more trauma-informed organizations. Within our practice, as a trauma-specific service, we regularly elicit feedback from the individuals with whom we work, and we use this information to be able to guide the services that we offer. And we take this into account then when we're out providing consultation or collaboration. And it really helps to strengthen the work that we do and the communication that we have. And it's very, very encouraging for the people that we work with to know that they have a say in the services that are being provided. All right. Before we transition into some of the impacts of the global pandemic, I just wanted to mention too the importance of having safety within your workplace, within your team, to be able to provide trauma-informed care. As we talked about, being trauma-informed requires a lot of critical self-reflection, and having safety to have conversations within your workplace and teams really helps to promote more effective trauma-informed services. So thinking about what you might need within your team, within your organization, are there opportunities to be able to share, to be able to discuss maybe some of the concerns that you have or areas that you want to be able to build on? Being able to prioritize time to process your own internal reactions and have such conversations in a safe way certainly helps to increase more effective trauma-informed work within the workplace and within teams.
Okay. It would be really difficult to complete a presentation on trauma-informed care without at least talking about briefly the global pandemic and COVID-19 and the impact on all of us. So we know that trauma-informed practice has never been as important as it has been during the last 2 years, when individuals have had to cope with so much change and uncertainty. And perhaps it has never been as challenging as it has in the last couple of years as well, as we've had to deal with changes every single day. So the COVID-19 experience in and of itself is traumatic for many. Extreme unpredictability, prolonged and based in unfamiliar danger, which is likely to activate a physiological danger response and produce intense stress. So as organizations, just being aware, I guess, of the practice principles, breaking them down further here into trustworthiness and transparency. We know information has changed day to day, sometimes hour to hour, the things that we are hearing from public health guidelines. So as organizations and teams, what increases trustworthiness is passing on that information as quickly and efficiently as possible. Safety. We know that physical and psychological safety has been impacted within organizations, certainly through this last 2 years. As organizations, making sure people have adequate supply of PPE, making sure they have adequate physical distancing to complete their work, making sure as well that there are appropriate psychological resources like employee and family assistance programs and other resources for employees to help cope. Peer support. For many individuals within organizations, we have been separated from teams physically. And as organizations and teams, promoting any sort of connection between peers and coworkers, whether that be by Zoom or any other means, because it is so, so important. Collaboration. So having an open dialogue with the individuals who are working on the front lines. So eliciting feedback. One of the examples I can think of is for our team, we were able to have some input into forms for virtual care, which we were providing. And we know that, healing comes when individuals have say and there is some shared ownership in the decision making, empowerment and choice. Over the last couple of years, our choices have been limited. Certainly, employees have been limited. People have been deployed to different areas. There's been many restrictions, and offering choice whenever we can is important. And also considering things like cultural, historical, and gender issues. Things like people who have had to care for children, social inequities that were long in place before the pandemic and the impact on individuals. And also just wanted to talk briefly about the global pandemic and social workers. So following the practice principles as much as possible throughout this pandemic is so important. Finding ways to stay connected. We know for many of us, we have been isolated from our teams, and just dealing with our own emotions as social workers, it has been more difficult to regulate for clients and for us as social workers. And many of us have been challenged with some of the changes in public health guidelines, and just really reflect on the hats that you have had to wear as a social worker. You have had to learn about sanitation measures and PPE. You've probably been a parent providing homeschooling. You might have been diagnosed with COVID-19 or had to isolate or care for family members or been isolated from family members. So most of all, provide that self-validation to yourself and give yourself self-compassion for all that you have experienced and the hard work that you have done and continue to do.
Okay. And to build what Tammy has just said, and just reiterate the importance of reflective social work practice. As social workers, we have been granted the privilege to be able to provide and create safe spaces for healing. And with that can come a lot of heaviness, especially as we attempt to navigate unknown territory, as Tammy just discussed there briefly around the global pandemic. So being able to check in with yourself, to be aware of any signs of compassion fatigue or vicarious trauma, being able just to kind of reflect and notice, have I been feeling more exhausted lately? Am I more quick to anger? Am I losing interest in things that I normally would enjoy? Am I not coping in the same ways that I have before? Do I have more difficulty in making decisions? Am I feeling less satisfied? How have my beliefs changed as a result of what has happened in the world, particularly this past 2 years? Being able to ask yourself those questions, to reflect on your own individual experiences and impacts, helps to prioritize your wellness, and thus helps to support you in continuing the offering the service in which you provide. As social workers, I think it's incredibly important as well that we create safe spaces to have these discussions with colleagues, because sometimes when a professional may be experiencing some of these impacts, it might be hard for them to see it. So building relationships with your colleagues to be able to have those discussions. Within our team, we try to prioritize time, whether it would be on Zoom or back in when we were back in the office, to kind of talk about our highs and lows of that week, to be able to check in with one another. We also try to role model to the individuals with whom we work the importance of self-care. So just sharing with them what we're going to do at the end of group session to take care of ourselves. All of these practices are certainly so important for us as professionals.
Okay, and we just wanted to end off with a very important slide. And this was tweeted by the CASW last week, and the credit is listed on the screen. Dear social workers, everyone I speak to this week has been letting me know that this is one of the hardest weeks they've had most recently. We do such hard work, which impacts us on all layers of self. Remember to look after yourselves as well as others. Mind, body, heart, and spirit. And we would also like to highlight there are some tools in the slides toward the end as well. We've included the personal rights, which is a good tool in working with clients, some grounding techniques, a copy of the trauma tree that we referenced earlier, as well as our references. And a big, huge thank you to each and every one of you who have taken this time with us today. Happy Social Work Month to each and every one of you. And we certainly hope that you take some time to celebrate yourselves this month. And sincere thank you for this time with us this morning. All right, and we will invite Annette to join us back.
Can everyone hear me? Okay, yes, okay, I'm back there now. Thank you so much, Tammy and Jasmine, for that stellar presentation. That hour went by so quickly. Oh my goodness, it was such a lot of wonderful and great information that you were able to share. We do have a couple questions, and we do have some time for those. So someone noted that they really enjoyed the presentation, and that certainly a lot of the information was affirming and empowering. And the question is regarding: do you think more support groups and peer groups are essential in terms of trauma-informed work? What your thoughts are around that?
I can answer that. Definitely peer support is a key ingredient. And access to more peer support would certainly be helpful. We know that there are some peer support groups that do meet. We have PTSD Buddies is one group. And definitely any opportunities in your communities that you can facilitate or encourage peer support is so important. We always encourage people to avail of peer support in our own community, and it might not be specific to trauma, but peer support through an organization that we have called Channel Community Health Awareness Newfoundland Labrador. So answer to your question, yes, absolutely. More peer support will be quite valued and so important.
Wonderful. Thanks so much, Tammy. I think we lost Jasmine for a moment, but it looks like she's coming back on there now. So that's great. Welcome back, Jasmine.
My apologies.
No worries at all.
Went blank.
Yes, that happens. So we do have another question that's come in around strategies that you can think of when a youth or an adult who are using, behavior to act out, for lack of a better words, they've experienced significant trauma, and how can we as social workers explore this with the individual who may be using aggression towards staff?
One of the strategies, I guess, is using any safety strategies that you can. And for situations like that, you might not necessarily get into like the specific processing of the trauma, but being able to work with the individual often around just identifying feelings. Because if an individual has experienced trauma, they might not have the language to be able to express, I actually feel angry in this moment, or I feel upset, or I feel threatened, or I feel closed in. So one of the tools, just a hands-on tool, might be working with the individual around like a feelings wheel, or just getting them to start to recognize what is it that I'm feeling, and what are some of the things that the individual might gravitate to that might help activate their relaxation response. Like, is it an individual who likes sketching or likes artwork or likes music, or what kind of things could you implement in the environment? And also asking the individual, I guess, what they need, because sometimes when an individual feels upset or feels aggressive, physical space might be something that might be really important to think about. Just tone of voice that you use. So those might be some helpful hands-on tips, hopefully.
And I can just add a little bit, and I apologize because I missed a piece there. But I know from working with emergency services, sometimes being able just to help the individual verbalize the specific emotion that they're experiencing and explore the message or like the reason behind it. Sometimes if a person is acting out, for example, it's like being able to say, like, I can see you're really angry and I wonder what's underlying that. Like, I wonder, and exploring it from that curious perspective can really help to diffuse the intensity of that behavior, because that's something that we certainly try to educate people on, is being able to separate the emotion from the response, that it's completely normal to feel angry. And it's what you do with it, the behavioral piece, that can sometimes, be quite challenging. And from that perspective, I find it really helps to kind of diffuse the situation, being able to validate, like, yeah, like I'm really angry, and this is why, or this is what I need.
Mm-hmm. Thank you. Thank you for that excellent response, Tammy and Jasmine. I think we have time for one more question before we close the session this morning. In terms of an organizational or team-based response, do you think it's important that non-clinical staff also be educated around trauma-informed practice?
Absolutely. We are firm believers that everybody in an organization should be educated in trauma informed practice. And we have been able to participate in developing a webinar that's been offered to new staff in mental health and addictions. Because somebody answering the phone, any encounter with an individual, just being aware of how to respond, being aware of some of those physical cues is so important. No matter what your role, if you work with people, if you answer phones, if you are present, everyone should be trained in some capacity, I believe.
Okay, wonderful. Well, that pretty much brings us to our time. So I do want to take this opportunity to thank Tammy and Jasmine for this informative and stellar presentation, and for taking the time to join us today to share their knowledge, experience, and expertise regarding trauma-informed practice with us. A lot of important information was shared in terms of how trauma impacts people, how it may present in our work, and really considerations that we as social workers need to think about and can integrate into our work. And it is truly wonderful when we can come together to learn from our social work colleagues, enhance our knowledge and skills in providing high quality social work services, and celebrate Social Work Month. It's a great day, great morning all around. And Jasmine and Tammy, your passion for this work is so inspiring, and truly thank you for joining us today. The PDF of the PowerPoint presentation is available on the resource section of the webinar platform. I know we had some questions coming in around that. And also in the resource section, there's information on how to get involved in more Social Work Month activities within the CASW. If you visit socialworkisessential.ca, you can learn more. And there's some contests also where you can win some prizes from CASW. So check out those as well. Finally, we do want to ask that you complete the evaluation that will appear on your screen. Feedback is always certainly welcomed, and helps us plan for other sessions as well. So that's always great to hear from people. And on that note, I guess we'll conclude our session for this morning. Again, thank you everyone for joining us, and thank you Jasmine and Tammy, and enjoy the rest of your day, everyone, and stay safe.
Thank you.
Thank you, everyone.